Good day, ladies and gentlemen. Thank you for allowing us into your homes again. For another episode of your program, let's talk about infertility openly. It is a popular saying that prevention is better than cure. And more often than not, prevention is also cheaper than cure. The same thing with infertility. There are steps that can be taken to prevent infertility. But let me warn you, these are steps that should have been taken when the person is much younger, 15, 16, 17, 18, before the age of 20. One of the easiest ways to prevent infertility is to marry early. Career aspirations many times has moved people to push off settling down. And as the age goes, we cannot reverse the time. And we know that advancing age has an effect on fertility. The second step for us to take in preventing infertility in later years is to maintain a good body weight. There's something we call body mass index. For a particular height, there's a specific weight that is considered normal. We know, for instance, that when a woman is overweight, or the one is obese, or the man is grossly underweight, she's not likely to release eggs regularly. The same thing for men. When a man is overweight or is obese, he's not able to have intercourse properly, and then we may have erection issues. And this may also dovetail into sperm issues. So it's important to maintain the appropriate weight for your height, either a man or a woman. A very common way to have infertility is to have infection. So if we prevent infections, then the issue of infertility will be much less. We know, for instance, the commonest cause of female infertility is tubal blockage, and this is caused many times by infection. Many times these infections are sexually transmitted. And if these things happen, we should make sure that they are properly treated. The effect comes down 10 years, 15, 20 years down the line. And it's important for us to notice this. It's an increasing trend among our young people to smoke nowadays. And I know, for instance, that smoking of cigarettes is becoming commoner. Smoking of something called shisha is also becoming commoner. Smoking has a very adverse effect on fertility. For women, it makes women to reach menopause earlier than they were supposed to reach menopause. So it also affects the quality of the eggs that they have. The same thing for men. It affects the quality of the sperms. It affects erections. It affects sexual drive. So smoking is a no-no if you're looking at fertility. We're not even saying reduce smoking, we're saying stop smoking. Alcohol use. Alcohol is a toxic chemical on sperms and on eggs, and its use should be reduced significantly. We know it may take some time to be able to cut it off, but reduce significantly because it's a toxic chemical on sperms and eggs. The other thing we should also cut out is caffeine. So people take coffee. So if you take coffee more than twice a day, that can impact on the long run on your fertility. Trying to revisit the issue of having a healthy body weight. A normal body weight is a function of two things: healthy food choices and exercise. Healthy food choices and exercise. So we should make healthy food choices and should exercise for at least 45 minutes, at least 3 times in the week. This helps us to maintain good body weight, and it also helps us to ensure our fertility in the future. Till I come your way again, I want to emphasize prevention is better than cure. Have a fantastic day.